everybody, and welcome back to another edition of Eyecare Today. I am your host, Dr. Thomas Kislan, and we're coming to you today from our office in Hazleton. That's Hazleton Eye Specialists on the Airport Beltway in Hazleton. Remember, with any questions, comments, concerns, anything you'd like to see on future shows, please give our office a call, 453-2020. That's Hazleton Eye Specialists, 453-2020. And for those of you watching in our Stroudsburg area, our Stroudsburg office is Stroudsburg Eye Specialists, 852 North 9th Street in Stroudsburg. Our phone number there is 421-3342. As always, look us up on the web. Our website is www.drkislan.com, and all of our shows can be seen, all of them are saved. They can be seen anytime, 24/7 on ssptv.com. Look for Eyecare Today. You can watch any of our shows anytime. What happens in summertime is one of the things that happens to a lot of patients when we get into the dead of winter also. Dry eye disease becomes a very prevalent condition. A lot of people think that dry eye is worse only in the winter because we've got the heat on and the blowing warm air in office buildings. But what happens in the summer, air conditioning really affects the eyes. So not only do we have blowing air from air conditioning, but a lot of us have ceiling fans on. We'll put stationary fans on in the house that blow air, and that can really make dry eye worse. So today's show is going to focus on dry eye. And what we always try to do on Eyecare Today, remember, this is the place where you're going to get all your latest information, the newest technology, anything that's latest and greatest in eye care, you're going to find right here on Eyecare Today, nowhere else. We're going to talk to you about what I think is one of the biggest breakthroughs in technology in the days since I've been practicing over the last 17 years or so. It is 17 years. I'm getting gray and it shows. So this is some very interesting technology. It's called LipiFlow. And we're going to dive really into LipiFlow. But when I reflect back on eye care and where we've really come, and we go all the way back to the advent of glasses, just think what life, for those of us who either wore or wear glasses, just think what life would have been like if we didn't have glasses, if Ben Franklin didn't invent the monocle. Life would be very blurry for a lot of us, and we'd be missing a lot of things. So obviously the invention of glasses was a big milestone in eye care. And then for those who couldn't wear glasses or had such large prescriptions, the advent of contact lenses was probably the next biggest thing in eye care to really help the population. After contact lenses, we start getting into some disease management, and probably the ability for us to prevent someone from going blind from glaucoma with some of the amazing eye drops we have nowadays is probably the next thing in eye care to be just amazing. You know, patients years ago would lose their vision at 30, 40, 50 years old. I mean, the life expectancy years ago was maybe only 50 years old or so. But, you know, the ability to slow glaucoma is really amazing. And then we get into in the last 5 years where we now have injections for macular degeneration. So for one of the forms of macular degeneration, we're actually ability to do injections into the eye to help slow that down. So that's really been the next milestone in eye care that really has helped patients. So if we look at what's been out there, again, glasses, contact lenses, the development of good treatments for glaucoma, macular degeneration, and now we come to something for dry eye disease. And a lot of patients think, and a lot of people think dry eye is just this measly little condition that doesn't really bother anybody. Depending on the studies we read, anywhere from 35 to 50 million Americans suffer from dry eye disease. Dry eye disease costs the average American who has the disease anywhere from $2,000 to $3,000 a year on treatments. And they've averaged it out that it can come to a loss of net worth or even a loss of productivity in the workplace of up to $3,000 to $5,000 a year. So dry eye disease is a really devastating disease. And we now have a treatment that, in my opinion, is going to be the next thing that can help eliminate this condition. We've had some great treatments, which I'm going to get to in a little bit here, from eye drops to something called plugs to omega-3s, which you've heard me talk a lot about. But what we're going to talk today about is something called LipiFlow. And you can go online. LipiFlow.com is a great website that you can reference and kind of look at some things. after our show today. YouTube is a website where you can go and actually type in and search LipiFlow, and you'll actually be able to see some of these treatments being performed. But dry eye has become this condition that I probably see 15 to 20 patients a day with this condition, and some are doing well, some are really suffering. So now we finally have the ability to offer these patients a treatment that really makes sense. And what we're going to get to in this show, and we're actually going to have a follow-up show. This is going to be a two-part series. In the second part, you're actually going to see a live treatment being done, which is pretty exciting. And I'm also going to have a patient on who's going to talk about her experience with having the LipiFlow procedure performed. LipiFlow is a painless 12-minute treatment that's done right in the office. And I'm sure all of you are saying, well, what is it and how does it work and how's it going to help me and all those questions. And those are all questions we're going to get to. That's what this show and our next follow-up show is about. So what I'm going to do, folks, is I'm going to take a quick break here, take a quick commercial break, and when we come back, we're going to talk about what dry eye disease is, how it affects us, what some of the treatments are that we have now, and then we're going to talk about LipiFlow itself. Remember, if there's ever any questions, feel free to contact us, 453-2020 in Hazleton and 421-3342 in our Stroudsburg office, www.drkislan.com, and look up www.lipiflow.com. That's where you can get a lot more information after our show today. So we're going to take a quick break. We'll see you right back here on Eyecare Today. Welcome back, folks. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and like we said before, if there's ever any questions, give our offices a call. Hazleton 453-2020, Stroudsburg 421-3342. Website is www.drkislan.com. Dry eye disease affects 35 to 50 million Americans every year. Costs the average dry eye sufferer anywhere from $2,000 to $3,000 in treatment, and can average a loss of productivity in $3,000 to $5,000 a year. What a horrible condition this is. Why don't we hear more about it? Honestly, folks, this is a condition that's been around a long time. I see a lot of patients that have this condition, and the problem is there's never really been any great treatments for it, but now there is. So what is dry eye disease? Well, basically there's two forms of dry eye. The first form is something called aqueous deficient dry eye, which means our eyes just don't produce enough tears. And when our eyes don't produce enough tears, they obviously get dry, scratchy, gritty, picky, red. One of the number one symptoms is fluctuating vision. What I mean by that is patients will be driving home at night and they got to blink and try to clear things up, and they say, gee, if I blink a couple times it gets better and then it gets worse again. That's very common. But one of the major symptoms that a lot of patients just don't understand, and if you have this, this may be something we need to talk about, is watery eyes. So from dry eye, your eyes can actually be watery, and you're probably saying, well, how the heck can that be? Well, what happens, think of if we cry or if a bug flies in our eyes actually water. That's called reflex tearing. And what happens with reflex tearing is the brain senses something's wrong and it tries to fix it. So it kind of tries to wash everything out. So with dry eye, our eyes actually get irritated, the brain says something's wrong, and it'll start flooding it with tears. So remember, watery eyes can be one of the major symptoms of dry eye. The second type of dry eye that we see, and it's actually the major form now, it's actually called lipid deficient dry eye. So I actually have a video that I'm going to show you in a little bit here, but we have little tiny glands along the margins of our eyelids. They're called meibomian glands. And these glands actually secrete the oil part of our tears. And the way our tears work is that, think of an oil slick on water. We need to have this oil layer on the top that prevents evaporation of our tears. So just like you have an oil slick on water, we actually have an oil slick on the top of our tear film. If that oil slick isn't there, our tears just evaporate away, and the whole snowball effect of dry eye just goes on and on and on. So we need to have a really good oil part of our tear film. Again, that oil comes from what's called the meibomian glands. over time and over the years, and with certain conditions like rosacea and certain types of acne, and just we see it in a lot of Caucasian patients, white patients, kind of Irish descent, light hair, light skin, light-eyed. These oil glands just get blocked over the years. They don't work as good, and they don't produce the proper types of oils. If they don't work well and they're not functioning properly, we get this lipid deficient dry eye. And that's where LipiFlow actually helps. And the key to being treated properly for dry eye is having a good evaluation. So if you're suffering from any of these conditions, it's absolutely imperative that you get in and we take a look and really evaluate what is going to be the best treatment option. So really to evaluate what's going to be the best, whether it's drops or Restasis or omega-3s or LipiFlow, the key is to understanding what's going on with the condition. So I have a really nice video that I'm going to show you here. So we're going to take a break here and you're going to see this video, and then when we come back we're going to talk about it. So we'll be right back.
The primary components of tears, mucin, aqueous, and lipid, combine to create a complex viscoelastic structure. This complex structure is responsible for a multitude of important functions. Lipids prevent evaporation, lubricate, and stabilize the tears. Meibomian glands at the margins of the upper and lower lids produce and inject complex oil into the tears with each blink. This thin layer of oil prevents tears from evaporating and increases lubrication and comfort. Additionally, the phospholipids found in this oil stabilize the tear layer and improve cohesiveness. In a healthy eye, tear production is carefully balanced and controlled. Excessive evaporation of tears can stimulate overproduction of the aqueous component. This chronic overproduction of aqueous may be linked to eventual inflammation of the lacrimal gland. The symptoms of dry eye can include feelings of dryness, grittiness, burning, ocular tiredness, and discomfort. The oil produced by the meibomian glands becomes increasingly cloudy and thickens further to a paste-like consistency. On manual expression, these properties, as well as plugging of gland orifices, may be evident. As the condition worsens, eyelids display signs of inflammation and dilated blood vessels. With dry eye, sensitivity to environmental factors like wind, temperature, and humidity increases. Interference with normal vision may become noticeable. Often, the individual considers it part of the normal aging process, when in fact, dry eye can have a significant impact, causing loss of productivity and poorer quality of life. One of the most common treatments for meibomian gland dysfunction and associated dry eye is at-home warm compress therapy. This approach has limited clinical effectiveness. Heat is wicked away by blood vessels in the eyelids, limiting the amount of heat reaching the meibomian glands. Beyond the lack of effectiveness and the onerous routine for the patient, use of warm compresses can introduce excessive pressure on the globe. The LipiFlow system uses heat and pressure to clear blocked meibomian glands. By applying heat directly to the glands on the inner eyelid surface, heat rapidly and efficiently raises gland contents, liquefying any blockage, making it easier to remove from the gland. Gentle pressure is applied from outside the lid from the base of the gland to the gland opening, removing blockage and flushing dead cells from the gland. During this process, stagnant gland tissue may be removed from the glands. Maintaining normal meibomian gland health and function is critical to the long-term maintenance of ocular surface health and good vision.
All right, so that's a pretty interesting and in-depth video, but I think it really hammers home what's going on with dry eye disease and specifically with this lipid deficient dry eye. And again, this is the most common type of dry eye, and it can affect everybody. Again, not just more senior patients. It's very prevalent in contact lens wearers. In fact, lipid deficient dry eye is the #1 reason patients stop wearing their contact lenses. It affects patients who've had any sort of eye surgery. So if a patient's going for LASIK or cataract surgery, it's very important that we make sure they don't have this problem. But it can affect everybody. So the treatments that we've had in the past, one would just be artificial tears. And unfortunately, artificial tears, all it does is kind of wet the eye and then the tears just evaporate away. So tears don't really work really well. The second thing is a drop called Restasis. Now what Restasis does is it actually helps calm the inflammation that we get on the surface of the eye, which really can provide relief, but it doesn't hit the root of the problem. So a lot of times we need to do additional things besides Restasis. We also have some mild steroid eye drops that we use, and we also use something called punctal plugs, where we actually put a tiny little, it's about a half the size of a sesame seed, into a plug into the bottom tear ducts, which helps prevent our tears from evaporating as quickly. So that can be very beneficial. And omega-3s are very good at loosening up and getting us better quality oils in those meibomian glands. But if those glands don't work good, like you saw in the video, we can make that oil as good as possible, but if those glands aren't secreting like they should, we really end up with some problems still. So omega-3s definitely have their place, but we need to really work on getting those glands working more efficiently. And that's really where LipiFlow has come in and really been a benefit to patients. And what LipiFlow is, it's basically a 12-minute in-office treatment that provides targeted heat and massage, micropulsations to the glands in the eyelids. And again, this is amazing technology, folks. They've been working on this for about 10 years, and finally it's come out, and we're very proud to be the 5th place in Pennsylvania. There's only about 40 in the country that actually provide this treatment. We're the 5th in Pennsylvania. So right here in Hazleton area and in the Stroudsburg area, you can have this treatment performed. And again, we're very proud to bring this technology to the area. So LipiFlow is definitely something that could be beneficial for our dry eye patients. So if you feel like you're suffering from any of the things we've talked about, please call our office, 453-2020, 421-3342 for a consultation. Medical insurance actually covers the evaluation for this. So, you know, Blue Cross Blue Shield, Medicare, Geisinger, any of those covers the evaluation. So give our office a call. We need to take another quick break here, and when we come back, we're going to talk more about LipiFlow, what it is, how we diagnose, and lots more here on Eyecare Today. We'll be right back. Welcome back, folks. Again, you're watching Eyecare Today. The only place you can get all the latest and greatest information on Eyecare, the newest technology. Remember, 421-3342 for our Hazleton office. 421-3342 for our Stroudsburg office, and 453-2020 is our Hazleton office. www.drkislan.com and www.lipiflow.com to get even more information past what we're talking about today. And what we're talking about today is dry eye disease and the latest treatment that we are so proud to have brought to this area now, called LipiFlow. We are the 5th practice in Pennsylvania to be able to offer this treatment. The only other places in Pennsylvania, Allentown area, 2 practices in Philadelphia, and 1 down in the border between Harrisburg and Maryland area. So Northeast Pennsylvania has been lacking this technology. We've brought it in and we're proud to offer it. What is LipiFlow? Well, like we were saying, dry eye disease affects anywhere from 35 to 50 million Americans a year. This is a 12-minute in-office treatment that provides heat and micropulsations to the glands in the lids, which you saw in the previous segment, the little video we showed, to help open up those glands, get those oil glands secreting better, provide a better oil to the tear film, and help alleviate the symptoms for dry eye disease. How do you know if you have this condition or if you're going to benefit from this treatment? Well, you need to come to someone who specializes in ocular surface and dry eye disease, and ladies and gentlemen, that's what we've built our reputation on. Basically, when you come in, we're going to go over your medical history, we're going to go over how long you've been suffering with this condition, any previous treatments, and we're really going to give you the once-over as far as your eyes go. But there's some specific testing that no other practice in the area has, and I'm going to reference these a little bit here. One is called a meibomian gland evaluator, and we'll show you a close-up of this also, but this little instrument I use to actually depress the glands in your eyelids as I'm examining them to see exactly how they're flowing. And believe it or not, this little device cost about $30 million in research and development to come out with. So it's a really amazing piece of equipment that we use to help diagnose. The second thing is to my right here. This is called an interferometer. And basically patients, when they come to our office, we have them look into this machine, and it provides us, and you can see up on the screen here, it provides us a large image and movie of their eye basically and how their eyes blink. And what we're looking for is not only how they're blinking, but the oil part of their tear film, which we talked about. And if you look on my right here, this video, there's an oil slick on the tear film here. And you can actually see more color in this tear film. You can see more blues and yellows and purples versus on my left, that image really has not much at all. And when we look at some of these lines here, and again, a lot of this doesn't mean much to the average viewer out there, but basically this is a higher amount of oil in the tears, and this eye actually has much lower amount of oil. So this patient actually has much worse meibomian gland disease in their left eye versus their right eye. So it's really, this is an integral part of diagnosing and managing this condition. So if you think you have dry eye disease, specifically lipid deficient dry eye, it's very important that these tests are performed to see if LipiFlow, again, which is the newest technology, the latest and greatest treatment for dry eye, if you may be a candidate for that. And again, like I've said, we are proud to be only the 5th practice in Pennsylvania to be able to offer this treatment. Feel free to give our office a call, come in, see if you're a candidate for this. Again, it's a 12-minute painless treatment we do right in the office. It's heat and micropulsations to the eyelids that provide treatment and help alleviate the symptoms. And I wouldn't go so far as possibly say cure, but I'm actually seeing that in all the patients we've treated so far. These patients are really, really doing well. So we can really help patients finally with a real dreaded condition. And like I said before, this is going to be a 2-part show. So we're going to wrap it up here in a couple seconds, folks. We went through a lot of information, but on our second show, you're actually going to see a live treatment. We're going to show you exactly what it's like having it done, and then we're going to talk to a patient who suffered from dry eye for a lot of years. I've known this patient a long, long time, and she's finally doing better. And we're going to talk about her experience with LipiFlow. So the questions are you a candidate for LipiFlow? Do you have dry eye disease? If those are questions in your mind, call our office, 453-2020, 421-3342 in Stroudsburg. And remember, look us up on the web, www.drkislan.com, or go to www.lipiflow.com. And if there's any questions, feel free to call us. This has been Eyecare Today, folks. I'm your host, Dr. Thomas Kislan, and we'll see you on the next show. Have a great day.